All right, so I'm going to do some hand hygiene. Then I'm going to knock on the door and walk in. Hi, Stephen. My name is Rebecca. I'm with Respiratory Therapy. Can I get your name and birth date?
Yes, it's Stephen Stout, and my birthday is January 1st, 1992.
Perfect. All right, well, it looks like the doctors ordered an ABG today. That's an arterial blood gas. So we're going to do that today. And basically what I have to do is I'm going to stick a little needle in the artery in your wrist. And it's going to give us some really good information about how you're breathing, okay?
Okay.
All right, have you had a test like that done before?
I have not.
Okay. Well, does it sound okay if we get started?
Yeah.
All right, do you have any questions?
Does it hurt?
Yes, it will hurt. Whenever we stick a needle in, yeah, it's generally going to hurt. Also, our arteries have nerves around them. So if we were to hit one of those, it would hurt, but I'm going to do my best not to and make sure it hurts as little as possible, okay?
Okay.
Alrighty. Let's see here. I'm just going to put this pulse ox on your finger, and I'm going to talk you through the whole procedure. So I'll let you know before I stick you, so there will be no surprises, alright? Okay, this pulse ox is just going to give us some information while we're doing the test, okay?
Okay.
Alrighty. I'm going to lift the bed up.
Whoa!
And feel for a pulse on both sides, alright? So I'm going to feel on this side, just on the outside. Got a good pulse on this side. Is it okay if I feel the pulse on the other side?
Yeah.
Alright.
I don't know if this one will work.
Alright, that pulse is good too, but I'm liking this pulse better, so we're going to stick with this arm.
Okay.
And I'm going to need you to do a fist for me really quick. This is called the modified Allen's test. We're just looking for your circulation in your hand, okay?
Okay.
So keep that fist clenched really, really tight. I'm going to have you turn it up this way a little bit for me though. And I'm just going to put pressure on both sides of your wrists, alright? Okay, tight, tight, tight fist. Good, alright. Open your hand for me. Perfect. And then I'm going to let go of this one. Alright, you see how your hand went all red there?
Mm-hmm.
Okay, that shows that you've got good circulation in your hand.
Oh.
So we're doing good. And that would be a negative Allen's test in recording. Okay, I'm now going to get my kit ready, so I'm going to open it up. And I'm going to take my needle out and draw it back to 2 milliliters. And then I'm going to get my Band-Aid ready. Just put it on the side of the bed here.
Oh. It's a nice Band-Aid there.
Yeah, isn't it?
One of my favorite colors.
Oh good, I'm glad I picked the right one. Alright, I've got my extra gauze here. Okay. Alright, I'm going to grab my alcohol wipe. Open that up. And then I'm going to put this roll underneath your wrist here. Okay, this just hyperextends it a little bit and makes it a little easier to get the test done, alright? And then I'm going to accidentally open the iodine. This is the alcohol. Hopefully I didn't stain my couch here.
Did you spill on the couch?
No, it didn't spill, thankfully.
No.
I know, but it's on my gloves. Okay. So this is just going to be cold, not painful at all. I'm just going to clean right here where we're going to do the test, okay? You're doing fine. Alright, we're just going to let that dry. Oh, don't blow on it.
Oh, sorry.
We don't want to get anything in there. It's got to be sterile, so. Alrighty, it's dry, so I'm going to grab my needle. Don't worry, I'll let you know before I poke you. I'm just going to feel for your pulse again. Alright. Got the pulse on this side. And I'm going to make sure that my needle is bevel up. It's a little hard to do with the cap on, but make sure it's bevel up. And then, alright, you ready? Big stick right here. okay?
Yeah.
Alright, and then I'm going to advance it slowly until I see a flash. Oh, okay, good. Got a flash. And then I'm just going to wait for it to fill up. And I'm going at a 45-degree angle, straight on. How you doing? You doing okay?
Yeah.
Alright, you don't
I'm
have to
okay.
watch if you don't want to. You can close your eyes.
I'll be brave.
Okay. Alright, so I've got a good amount of blood, and I'm going to write the respiratory rate that I've gathered from counting his breathing, the SpO2 from my pulse ox here, and the, he's not on oxygen, so I'm just going to write room air, because there's no liter flow and no FiO2 to write down. Okay, my syringe here is full, so I'm going to grab my gauze. I'm just going to lightly put this gauze right here, okay? And I'm going to pull out the needle really fast and apply pressure.
Oof.
Doing alright?
Oh, yeah.
Okay, good. Will you apply pressure here for me?
I would love to.
Alright, some good pressure there, okay? Alright, then I'm going to cap my needle. You can't see, but I've done that. And take that off. And then I'm going to put the stopper on it, or the cap on it. And I'm going to flick it. And get all my air bubbles out. Okay. All the air bubbles are out, and I'm going to go and run that immediately, so there's no need to put it on ice right now. If I weren't going to run it immediately and it was going to be more than 5 minutes, I would need to put it on some ice slush. Okay, I'm going to take over holding pressure for you, okay? Are you on any blood thinners like Wayfair or heparin?
Nope.
No? Okay, awesome. I'm just going to hold this for 5 minutes and then make sure that he stopped bleeding. Yep, 5 minutes has gone by. Alright, are you still doing okay? Yeah?
Yeah.
Feeling alright? Not too dizzy or anything?
Not too bad.
Good, okay. Well, it looks like you've stopped bleeding. So we're going to get this Band-Aid on you. Harder than it looks to be close.
Oh.
Doing okay?
Yeah.
Alright, good. Okay, so we're all done there. I'm going to go run your blood through our ABG machine, and we'll see how you're doing, okay?
Okay.
Alrighty. And then I would go out and take my sample, put it in the baggie, take off my gloves, and write down the, well, there'd be a little tag here around the needle. Should probably do that first. I'm not going to unstick it though, so I put that around the needle after writing the information on the little sticker here, and then I would go out and run the ABG.
What are you doing later tonight?